Thanks for listening to the Thyroid Fixer podcast with your host, me, Dr. Amie Hornaman, aka the Thyroid Fixer. Also, functional medicine practitioner, hormone and weight loss expert. We're talking all things thyroid, hormone, and health related in order to empower, educate, and transform you. Remember, I fix your thyroid, I fix your hormones, I fix your life. So let's get started. Welcome from the Midwest. I come to you no matter where I am, and I'm hoping you can hear me. Medications or the natural route. So let's break this down. Medications, T4, T3, NDT, slow release T3, compounded. We can go over each one separately if you'd like, but those are your thyroid medications, and they all do different things because we talk about this ad nauseum, right? T4 is inactive, T3 is active. T4 is the inactive thyroid hormone that has to be converted to T3. T3 is what gets into your cells. Every single cell has a receptor site on it for T3. Then you have your NDTs, which are a combination of T4 and T3. And we have the compounded medications, which are T4 and T3, but it can also be actual T3 in a compounded form. I've had some patients recently say, well, I'm on compounded T3. I go, how much? They go, I don't know. They're looking at their medicine ball. They go, I don't know how many micrograms are actually in each capsule. I'm like, that's really important to know. And that's the problem that I have with compounded medications is that A, they normally don't work for my patients, and B, sometimes they're giving you this bottle that you don't even know what's in it. You don't even know how many micrograms of T4 and T3 are in each capsule, and that is bad. Because if you don't know, then the question is, does the pharmacy know? So this is going to be a game changer for you, and you can probably hear the excitement in my voice. The latest introduction, the latest member of the family to the Fixer line is Metabolism Fixer. And this, oh my God, I formulated this just for all my people out there that need to lose weight, that need help in the weight loss department, that can't lose weight no matter what they do, that feel like they have a slow metabolism, and that might be thinking of trying all those peptides out there, you know, the Beverly Hills soccer mom drug of choice for weight loss peptides. Or even if you're on them already and you're like, man, these are really expensive and I'm still not losing weight, add in Metabolism Fixer. Here's what I did. I took the power of T2, which increases your basal metabolic rate while you are sitting there watching Netflix. You're burning fat while you're watching Netflix. I combined it with a very unique patented ingredient called Suppressa. Suppressa has multiple clinical trials backing its efficacy in reducing your appetite, decreasing snacking, and providing way more control over your food intake. It is amazing. We also see improved emotional well-being, just decreased food cravings all around, reduced hunger, and weight management. Add on top of that, we have green tea extract, we have purple forest purple tea extract, both of which affect the metabolism in a very positive way without the jitters of normal fat burning supplements out there from the 1980s and 90s, right? The ones that made you feel like you're having a heart attack. You will not have that in any of my supplements, Thyroid Fixer or Metabolism Fixer. But Metabolism Fixer, ooh, yeah, we kicked it up a notch. It is in powder form, so you can drink it through your day. It's going to flavor your water. We got Orange Crush and Refreshing Citrus. I love them both. It is going to keep you under control all day long. So you throw a couple scoops in your water bottle in the morning, throw a scoop or two in your water bottle throughout the day. You will have fat burning and appetite control the entire day for what? An eighth of a price of the peptides? Oh my God, you can't go wrong. So grab some Metabolism Fixer today. Please let me know how you do on it. I am super excited for you. Super excited. Now, I know there's some of you out there that say, listen, compounded medication works fantastic for me. Good, great. That's the same thing as what I say with T4 only. I don't like it. I don't see my patients really thriving on it, but we're going to get to that. If you're not doing well on a certain medication, you need to be in tune with that. If you are doing well on a certain medication, then good for you. If you're doing well on T4 only and you're like, listen, I am thriving, I am awesome, I can lose weight, my hair is growing, everything is super amazing, then go ahead and stay on that T4. I don't care, because you're probably not even coming to me or even listening to this if you're amazing on T4 only, or if you're doing fantastic on your compounded medication. But if you're here and you're listening and you want to learn, we're going to break this down, because T4 only and a lot of the compounded meds just ain't cutting it for people. And I'm not talking about your labs. I am talking about how you feel. Yes, labs are important. Test, don't guess. Labs are absolutely important. I like to see them. I want to see that free T3 in the optimal range. I want to see your reverse T3 in the optimal range. Those are the two most important. But it always, always, always comes down to how do you feel? Those four most important words that are not asked at all, usually, by conventional medicine. We want to know how you feel to know how those medications are working. Okay, let's put the meds over here. We're gonna box them up. We're gonna come back and open that box in a minute. The natural route. I have many patients, well, not many, a decent handful, patients, listeners, followers, people in my Facebook group. They're saying, I want to go the natural route, and it absolutely can be done. Here's the thing. If you come to see me and you say, I want to go the natural route, here's what I'm going to do with you. We're going to look at your tests. Number one, thyroid test, don't guess. We're going to look at how you feel. Because if you're coming to me and you say, I want to go the natural route, but I feel like garbage and I can't lose weight no matter how hard I try, and I'm gaining weight and I'm losing hair and I'm constipated and I'm depressed and I have no energy, well, that's telling a story right there, isn't it? Then we look at your labs. And if those are in the shitter, that's a problem. And it's how far in the shitter they are. So if you and I are talking and you say, I want to go the natural route, and your free T3 is a 2, I'm going to probably try to talk you out of it. Or at the very, very, very least, we are going to use a glandular. We are going to use a thyroid glandular supplement. Now, I'm working on one right now for you guys. I will let you know. But the one I recommend as of the moment is Dr. Weston Child's thyroid glandular. So if you are, now do not take this if you are on thyroid medication. Remember this, we put that in the box over here. We're talking the natural route right now. We're talking the natural route. So there are thyroid glandulars that are bovine or porcine dried thyroid gland. Usually you'll see, New Zealand cows, thyroid gland. It's just that. They're taking the thyroid out of the cow or out of the pig, because the medications are the pig. Usually the supplements are the cow, but it can be a combination of both, because you will find bovine or porcine on the thyroid glandular supplement list on the bottle of where it's derived from. And they dry it up and they put it in a supplement form. Now, I have said this for years. And if anybody from the FDA is listening, I want you to put your earmuffs on. Muffs. I am waiting for the time that the FDA realizes that glandular supplements are the same damn thing as Armour. They're just not made by a drug company. Do they work the same? Yes. Here's the thing, though. Supplements are not regulated by the FDA, and we don't want them to be. FDA people, earmuffs. We don't want supplements to be regulated by the FDA, but we also are not guaranteed what's in those glandular supplements. That's why I always say buy from a reputable company, because that is of vital importance. Because if you don't know what's in it. You don't know if they're fairy dusting, because they can put anything on that label. They can say anything on that label, and they don't have to have it tested. They don't have to prove what is in there. So if there is 30 milligrams of thyroid glandular, you can, in your mind, equate that to 30 milligrams of Armour, 30 milligrams of NP thyroid, but you don't know 100% for sure. Drugs are regulated. Now, does that mean that every Armour pill that is popped out is absolutely 30 milligrams? No, because we've seen recalls with medications too. Last year, NP had 2 recalls Armor has gone really in the crapper, years ago? I'm not talking right now. Years ago, Armor had a slew of issues where people were like, why am I going hypo? Why is this not working for me? Glandular supplements are pretty much the same as medication, as your NDT medication. So that is why someone in my Facebook group posted, well, I really like to stay natural. That's why I use glandular supplements. And I said to them, it's pretty much the same thing as being on Armor or NP. You're just buying it instead of picking it up at the drugstore. And you're rolling more of a dice with the glandular supplements than you are picking it up at the drugstore. Kind of, sort of, because we certainly have no control over the manufacturers of Armor and NP, as we have seen them go wonky. But we do have control over where we purchase our supplements. So if we are purchasing our supplements from a reputable company, then you're pretty darn safe that what's in it is truly what's in it. So if you really want to go the natural route and your numbers are in the crapper and you have a slew of symptoms, then yes, I would go for a glandular, because we want to ultimately get those numbers up. Remember, the most important thing is that your free T3 is optimal, your reverse T3 is optimal. So reverse T3, we want below a 12. Free T3, we want in the upper quadrant of the range. Those are the two most important tests that I look at. That is what is most important for you to be optimal and you to feel your best. So if those numbers are in the tank, then all these other natural things that I'm going to talk about to hit on don't really matter, because your T3, what do I always say? Your T3 is never going to magically come up just by healing your gut. We can give you all the selenium in the world and magnesium in the world, and that is going to help T4 convert to T3. It'll help a little bit. But I got to tell you, in my experience, it's not bringing up a 2.0 free T3 up to a 3.5. It's not going to do that. Now, maybe some of you out there are like, hey, I healed my gut and my T3 went up. I get it. It absolutely can happen. Most of the time, it doesn't happen. Most of the time, if you're that low and you are suffering that much, we use a glandular supplement. Still in that natural route, realize that you're dipping your toe. Well, are you dipping your toe into the drug manufacturing realm, or is the drug manufacturing realm dipping their toe into the natural realm? Right? Because NDT medication, while it is made by a pharmaceutical drug company, and it is a written prescription that you have to pick up at your local Walgreens, it still is dried porcine thyroid gland, the same as what is in the supplemental form. So I don't know who's dipping their toe into which realm. Don't know, like chicken and the egg, which came first, right? Actually, we know which came first. Back in 1800s, am I getting my history correct? 1800s, the original thyroid medication was dried bovine and porcine thyroid gland. Then the makers of Synthroid came along. That's why NDT has a bad rap. But that's another, I'm getting on my high horse again. Bovine and porcine thyroid glandulars were the original thyroid medication. That's what started it all. And doctors back in the 1800s were giving it, and they're like, hey, people are actually getting better. So it's kind of crossing over. It's hard to actually say which came first, because they used the natural dried pig and thyroid to treat patients, and they got better. So it was technically medication, but now we can put it in medication or supplement form. Other natural routes that we go, well, we make sure that all of your conversion factors are working properly, meaning selenium, magnesium, iodine. We want your vitamin D optimal. We need your zinc to be optimal. We have to check your hormones, because if you're estrogen dominant, ladies or gentlemen, estrogen dominance will absolutely prevent T4 to T3 conversion. What if your testosterone is low? I've done a separate podcast just on the importance of testosterone and thyroid. You can go back and listen to that. We can stick the link in the show notes for people to link to that and listen to. Testosterone is absolutely vital. Males or females, doesn't matter. Men, yes, your testosterone is vitally important. And I see so many of you with low T, whether you have a thyroid problem or not. If you have a thyroid problem, you definitely, like 99.9% of you have low testosterone. If you are a man listening to this, or if you're a woman listening for your husband, if they have a thyroid problem, they have low testosterone. Now, they may or may not have high estrogen. We see a lot of high estrogen. May or may not have high estrogen, but they have a low testosterone problem. I promise you that. I promise you. Get them tested. And again, this is a whole nother podcast, right? But I don't want to go into the whole standard lab value range. Standard lab value range for testosterone goes from 250 on most labs up to 1100. Sometimes they even cut it off at 1000. And then the guy gets flagged high if he's over that, if he's using testosterone therapy. He does not get flagged low if he comes in at a 300. That is in the toilet. Guys, you need to be 600, 700. Ladies, you need to be at 40 on most standard lab value ranges. I know I have listeners in Australia, UK, other countries. It depends on what your lab value range is there. But here I'm going by total testosterone, 40 or above for women. And then we also look at the free bioavailable testosterone. Those ranges change per lab. So I kind of like it dead in the middle. Let's say the range is, 0.1 to 0.5. Well, if you're a 0.15 or if you're a 0.2, that's a little bit low for me. Now, I'll still look at your total testosterone, but we really want your testosterone levels to be optimal. We do not want you to be in a state of estrogen dominance. Very important. And all of the nutrients. Now back to iodine. Again, I did a separate talk on iodine. I throw this in every once in a while. Weston Childs and I, when we did our joint podcast, talked about iodine. It deserves some love. So iodine, it kind of like the Goldilocks effect. We want it in the middle. We want just enough and not too much. Now, Dr. Brownstein uses high doses of iodine, and he has great success with that. And in some patients, we can go up in the iodine without getting that bromide toxicity and that detoxification effect from it. So we can go up to 50 milligrams of iodine very, very safely. Most patients, stay at 12.5, 25 milligrams, and they do just fine. We do the salt loading protocol, and then we test their iodine. I've said this over and over again. I'll say it again. I have not landed on the proper way to test for iodine. I hear both sides of the story. I hear the serum. I hear the 24-hour urine. I hear the provoked urine test where you take 50 milligrams of iodoral and then you pee and you catch it. I think it's for 24 hours. I hear all sides of the story, and then I go, what's easiest for the patient and what can we actually do? So the provocation test is a specialty test, has to be ordered. You can go to Ulta Labs and order your own serum iodine or your own 24-hour urine collection iodine. So what's easiest for the patient? So with serum iodine, listen, if it's coming back low, chances are pretty good that you're low. Mine came back at a 6. That was low. And it was flagged low. So I started taking iodine. If you read the book, I recommend this as well, The Iodine Crisis by Lynn Farrow. Dr. Brownstein's work is in there. He does the foreword as well. And she quotes a lot of his work in many of his books. It's very, very interesting, the different conditions that iodine can help, from hair loss to fibrocystic breast disease, breast cancer. He had a couple patients. So she refers to Dr. Brownstein's work with breast cancer patients and them actually not only taking iodine, but rubbing it on their breasts and the effect it had on their breast cancer. So definitely read that book if you want to learn more about iodine, but iodine is very, very, very important for optimizing the thyroid. And that is another natural route that we can go. So we have to start slow and work our way up. But that's the whole story. If you listen to Dr. Brownstein, if I could ever get him on the podcast, if anyone has a hookup with Dr. Brownstein, David Brownstein, you let him know that I want to interview him on my podcast. I reached out to him, and he is like one of the hardest guys in the world to get a hold of. I want him on here so he can speak to you in his language. And it's not just me reverberating what I've read with his work. But he was in practice. He was in Michigan, the Goiter Belt. Hello, Michigan, PA, New York. I'm all up there with you. We're in the Goiter Belt, the Cancer Belt. So he was in regular practice, regular medical, conventionally trained doctor in practice who actually thought outside of the box. Yay, Dr. Brownstein. He had a bunch of patients coming in. He's like, all this is tying into you guys' natural route. right? So bear with me. A bunch of patients coming in saying, I'm seeing all these people and they all have thyroid conditions. They got goiter, they got nodules, they have hypothyroidism, Hashimoto's. And I have no problem. This is Brownstein. I have no problem giving them medication. I give them thyroid medication, they get better. I see it, I get it. But why do they have it in the first place? So he starts digging and he starts studying. And then he starts working with an iodine guru. And he finds that everybody is low in iodine. They're iodine deficient. Starts giving them iodine. They start getting better. Starts going up in the dose of iodine. They start coming off their thyroid med. Now, this is the one time that I will say, we're not going to heal your gut and make your T3 go up, but we could give you iodine and actually heal your thyroid condition and make that go up. Side note, I need to say this. I need to say this over here on the side, parentheses. Thyroidectomy, radioactive iodine patients, partial thyroidectomy patients. You need medication. We removed your thyroid gland. They removed your thyroid gland. You are no longer producing T4 and T3. There is no amount of iodine, magnesium, selenium, gut healing, hormone balancing in the world that is going to give you T4 and T3. Most importantly, T3. But without a thyroid gland, I really like to use both T4 and T3 if possible. If you don't have a major problem converting, you don't have the genetic predisposition to not convert, DIO1, DIO2 genes. So thyroidectomy, radioactive iodine, partial thyroidectomy patients, you have to stay out of the net. You can dip your toe in the natural realm. And we definitely, listen, even if we do medication over here, we are still going to look at your hormones and your estrogen and your selenium and your magnesium and your iodine and your zinc and your vitamin D and your gut and all that fun stuff that comes into play. We're not going to ignore you. We're not going to say, oh yeah, we're just going to give you, well, if you're in conventional medicine, and just here you have some Synthroid and an antidepressant, and we'll talk to you tomorrow. Talk to you in a year. We'll retest you in a year. Have fun with your T4 meds and your antidepressants and your statins. But no, if you're working with myself, you're working with a true functional practitioner that isn't just using the term functional, then of course we're going to pay attention to your iodine, your selenium, and your mag, and all your nutrients and all that fun stuff. But if you are just going the natural route, we have to pay a little bit more attention to that. And we can use iodine in higher doses. If you still have a thyroid gland and you want to go the natural route, we can still use iodine to possibly increase that T3 because your thyroid T4 needs iodine to convert to T3. Every cell in your body has a receptor site on it for iodine as well. So iodine and T3 are kind of the powerhouses for your body. If every single cell in your body has a receptor site on it, for both iodine and T3, that's major. That tells you how important it is. Is there a receptor site on your cells for T4? No, but there is for T3 and there is for iodine. So yes, we can use iodine to actually increase your T3 levels naturally. Now I said we come back to the medication box and we'd reopen that. I'm going to do a separate podcast, separate recording for you guys on when to take your medication, kind of the breakdown, and when to take it with your labs. It'll be really brief, really short. It'll answer a lot of your questions because those are big questions that I get quite often. In the medication box, let's reopen that, shall we? Those of you who are on T4 only, you have to check your reverse T3. I'm not a fan of it. If you're suffering with symptoms, it's not cutting it. I personally was on T4 only for 5 months. It did absolutely nothing. That is part of my story that you always hear me tell. I went back to the conventional doc, who at least thankfully diagnosed me. Thank God. I walked out with an answer after 7, you're fine and you're normal diagnoses. Walked out with a diagnosis and some T4 medication, took it for 5 months, did not notice one iota of a difference. Went back, said, hey, I was on my gateway computer. Maybe microfiche at the library. Hey, doc, there's this thing called T3. It apparently works really, really well. This is long before I got into this realm. Studied medicine, studied functional medicine, long before. This is me in your shoes. This is me going, hey, I can't lose weight and I'm tired and my hair is falling out. And even though I have hair extensions, I don't want it to be shitty hair with my hair on top, right? I don't want it to be dry and straw-like. I don't want my hairdresser to say, what's going on with your hair breaking? All these symptoms. And I go and they give me T4. But they gave me the diagnosis. They gave me the diagnosis, which I was happy about. I had an answer. But then I got this crappy medication that did nothing. So I go back, I say, hey, what about this T3? She says, nope, I don't do it. I move on to my real functional practitioner, not the functional practitioners that some of you are seeing who go by TSH only. I've seen a lot of that. You know who you are. You've already posted it. I've called you out and I've called your doctor out. And I've done multiple podcasts on this because this is a trend and this is an increasing trend. And this is a problem of people slapping on the term functional, but they're not really functional. So if your doctor's only testing TSH and they're only giving you T4, but they call themselves functional, get your money back. I went to a real functional practitioner who actually tested me thoroughly and did all the things, natural and medication wise. That is what we have to do with you. We have to look at the whole picture. If you're on T4 only, it's probably not working. We need to test deeper. We need to make sure you're converting. We need to check your free T3, reverse T3. If you're on T4 only and that reverse T3 is high, that's a problem. That's a problem. We have to find out why you're not converting, but we have to bring that down. How do we bring that down? Using T3 medication and reducing your T4 medication, because T4 is the only thing that converts to reverse T3. T3 doesn't convert to reverse T3. I get this question all the time too. And this is kind of like last week's podcast when I got back to the basics. I'm going to be giving you guys this a little bit more. So you might hear me repeating things a little bit more, but these are for the new peeps popping in and listening. They need to know this. And I think it helps for all of us to hear things multiple times because then it sticks. It's like second nature. You can rattle this off of the tip of your tongue, like boom, boom, boom. Yeah, I absolutely know that T4 converts to reverse T3. Girlfriend, what are you talking about? T3 doesn't convert to reverse T3, so you can help your friends. They're like, yeah, well, I'm taking this T3 and my doctor said it converts to reverse. That's something else I just saw today. I'm like, your doctor is completely illiterate in the thyroid and does not even know basic physiology. You need to leave because your doctor just told you that T3 converts to reverse T3. Your doctor just lowered your T3 medication because your reverse T3 is elevated. You are going to be screwed. You're going to go in such a deep hypo state. I can't even tell you why, because you are with a not knowledgeable, actually in this case, completely medically ignorant doctor. The only thing that converts to reverse T3 is T4. Whether it's your own T4 that your thyroid's producing and you just have a conversion problem, or you don't have enough selenium, you don't have enough iodine, you don't have enough magnesium, you don't have enough zinc, your vitamin D is low, you're estrogen dominant, you're insulin resistant. I forgot about insulin resistant too. All of those are huge conversion factors. Your gut's a mess, your liver isn't detoxing. So you could be producing your own T4 and that's converting to reverse T3, or you can be on T4 only medication and that's converting to reverse T3. Or here's the next step in the medication box. Or you're taking NDT and your reverse T3 is still high. Folks, NDT has T4 in it. NDT medication, remember back when we talked about the supplements? Glandulars, porcine, bovine, thyroid gland, it is T4 and T3. Armor Thyroid, NP Thyroid, Nature Thyroid when it was around, WP, is that even still around? Compounded T4 and T3 is T4 and T3. Now, usually, most of the time, it is an 80-20 split. 80% T4, 20% T3, because they are trying to mimic what your thyroid gland does naturally. So if you have Hashimoto's and your thyroid gland is being destroyed, if your thyroid gland isn't working properly with hypothyroidism and it's not producing enough T4 and T3, or if you had it removed, and then we definitely have to use medication, you have no choice because you're not producing any T4 and T3 anymore. NDT medications have T4 and T3. We have to make sure that you are converting properly, because if you're not, if that T4 in the NDT, hypothetical, you're on 90 milligrams of NDT. If you're listening to me, you're splitting it. You're split dosing it. You're doing 45 and 45. You're still feeling like garbage. We do a test on you. We find your reverse T3 is an 18. That's a problem. That's a conversion issue. That's above the optimal range where we like to see it. So you're taking that NDT, you have a ton of symptoms, your reverse T3 is elevated. What do? We drop your NDT medication, we add in T3. And that's another post, comment, whatever you want to call it, message, post, comment that I saw today, that someone's doctor dropped out their, they were on Armour and T3. And she's not my patient, so we didn't get into the when you take it, when you have your test, all of that. Her doctor pulled out her T3 medication because she said her T3 was too high. Well, what about your reverse T3? If that's too high, then pulling out the T3 is only going to make the situation worse. You have to lower the T4 because what? What did we just say? What converts to reverse T3? Give me an answer. What converts to reverse T3? Remember, if you hear this 7 different times, you're going to be able to tell your friend what converts to reverse T3. T4. What's an NDT? T4 and T3. What do we do if you have a high reverse T3? We have to lower the T4 somehow. So the beauty of multiple medications is that we can change the ratio. We can add in T3 to your Armour, your NDT medication, and change that 80-20 balance. I talk about that all the time too, but it bears repeating. We can use T3 medication to change that balance, to change that ratio. So now you're not stuck at 80-20 because maybe your body doesn't do well at 80-20. My body doesn't do well at 80-20. It does well at 0-100 because I'm T3 only. That's where I'm at. You might be best at a 50-50. You might be best at a 60-40. We don't know unless we test and try, and you're working with somebody knowledgeable that doesn't call themselves functional, and they're not freaking functional or integrative or naturopathic. And if any of you are listening out there, you take the term off of your label if you are not thoroughly testing, if you are not using T4 and T3, if you're not using NDT, if you're not open-minded enough to add in T3 to that NDT, stop using the term functional, naturopathic, or integrative. I don't want to see it anymore, because this is what we have to do to make patients better. This is what we have to do to make you as a listener better. Whew, yeah, that's a lot. Okay, medication box, natural route box. You can totally go either way, unless your numbers are in the tank. Then we at least have to use glandulars, because we could put glandulars kind of in the middle. It's kind of like over here we have all natural, totally natural, liver, gut, nutrients. Over here we have the meds, and right in the middle we got those glandulars, and they're kind of they're reaching both sides. But that's the beauty of it. That is the beauty of glandulars, is that I have used them many times with patients, and sometimes we'll even use it with medication. So let's say somebody is my patient from Australia, and I can prescribe in Australia. Yeah, and you're on T4 only. And there is absolutely nothing we can do, even in the private medical system, to get you T3. We can use glandulars. Absolutely, we can use glandulars. So that's the beauty of that falling kind of right in the middle, is that it dips its toe in the natural realm, it dips its toe in the medication realm, but it gives us an answer. It gives us an answer. Hopefully that clarifies for you guys. Medication versus natural route. Okay. As always, make sure you're subscribing to the Thyroid Fixer podcast. It's very important that you do so. That way you get all of the new stuff that comes out. Like the next one is going to be on when to take your medication with your labs. I mentioned that earlier. So I have a Facebook group now. It's the Dr. Amie, the Thyroid Fixer, Love Your Mirror group. The reason why I call it Love Your Mirror is because so many of you don't. And my goal is to give you hope and to get you loving your mirror. This is not the same as the Attuned Thyroid group. You cannot post your labs. I cannot answer medical questions in there if you are not my patient. So love the Attuned Thyroid. Stay in there, join it. You can post your labs. You can get patient support. You can ask questions. I am in there as well, answering questions. My private Facebook group, the Love Your Mirror group, is for you to get hope, to know me better. I'm going to give you trainings and insight and information. We're going to go deep diving into nutrition and supplements and working out and more stuff on thyroid, and everything that I post on my Facebook page too. You'll definitely see it in there, because with the Facebook algorithm, you're not seeing all my good stuff. From PDF downloads, freebies, guides, videos, trainings. We'll do a challenge eventually. You're going to get a crap ton of information in the Love Your Mirror group. So make sure that you jump in there and join, but also please stay in the Attuned Thyroid because I'm in there as well. Thank you so much for joining me today. I appreciate it every time that you're on. So again, subscribe to Thyroid Fixer Podcast. Jump into my Facebook group. You're going to get a lot of good stuff in there. Hey guys, thank you so much for listening to the podcast. I hope you loved it. And as always, if you would be so kind to leave a review if you are listening on Apple Podcasts, that would be absolutely amazing. I read all of them. Also, anything that you hear on this podcast is not intended to diagnose or treat any kind of medical condition. So we always recommend that you check with your medical provider, your doctor, your nurse practitioner before implementing anything that you hear on this podcast. And if you want to find out more about working together, you can click the link below in the show notes to book a discovery call. And there you'll be talking to a member of my team. They are an extension of me. They are amazing. And you and I will talk after that once we get you all signed up and you and I get to work together. All right. I hope to see you soon.